views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. As always, we encourage you to continue participating in this program by dialing 718-960-7261 with any questions you may have. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you, our viewers. You can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing sports medicine, certainly a topic of increased interest, whether it is related to sports and recreational activities or even routine exercises to maintain physical fitness.
Yes, Errol. On the one hand, we have our youngsters preparing for baseball, football, soccer, basketball, and ice hockey, while on the other hand, we have tennis, track swimming, gym membership, and otherwise many activities, numerous other activities. Joining us this evening is Dr. Oladapo Babatunde, Chief Sport Medicine and Surgery at Bronx Lebanon Department of Orthopedics, and he is also a widely acknowledged expert in the field and was also an assistant coach.
Team physician.
Team physician, right? Team
For the San
physician for the
Francisco
49ers
49ers
football
team.
Yeah.
Now, before we hear from you, Dr. Olatuli, let me encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261. And please call us. Now, Dr. Babatunde, let me begin the program by asking you to share with our viewers, describe the services, in other words, that are offered by your department.
Well, first off, thank you both for having me here. I'm excited to share some insights about sports medicine. So our department really treats the whole athlete. We focus on patients who have an interest of getting back to any type of activity. So we treat people who are professional athletes all the way down to people who just want to enjoy their morning jog or an evening walk. And we do this through various techniques. We always try to do a non-operative approach first. But oftentimes if there's a structural damage, torn ligament, injury to a meniscus or rotator cuff, oftentimes these need surgical treatment, and so we provide these services also.
Okay.
Okay. As the summer season approaches, what are the types of injuries that athletes and non-athletes should be concerned about?
You know, we treat all types of injuries, but the most common ones that we do encounter are injuries that are centered around the knee and shoulder. So things such as a labral tear in the shoulder, as well as rotator cuff and meniscus tear and ACL injuries in the knee are some of our most common injuries that, and particularly, we see an uptick of them in the summer.
Okay.
Why is that? Why summer?
I think because there's patients who are more dormant and are not doing much activity when it's cold, and as soon as the summer approaches, they want to get back into activity, but they
do too much.
And they push it a little too much.
Okay. Now, it is often said that an ounce of prevention is worth a pound of care. What types of preventive measures do you recommend for our viewers out there that are either considering sports, participate in sports? I guess there are two categories. Those that, as you said, recreational activities on weekends, as well as even the professional athlete.
This is a great point. We really focus on preparing yourself for any type of activity. So particularly stretching is very important. This can help loosen up your joints and ligaments to help for prevention of injury, as well as conditioning. So someone who has not been participating in activity doesn't really want to go out and run the marathon the first day. They want to slowly increase their activity. So if you haven't run for quite a while, the first thing to do is to go for a walk. They always say, crawl before you walk, walk before you run. So this is what you'd want to do.
Right. And when you say gradually, what do you mean exactly by that?
So if you wanted to, if your goal was, by the end of the summer, I want to run the 5K.
Right.
What you would do is you would first start with a walk, and then you would jog. So maybe you would jog 1 mile, and then you would jog 2 miles.
Right.
And then as soon as your cardiovascular fitness starts to pick up, then you can start going for the run. Everyone starts at a different level.
I see. Okay.
Okay, let's move to some specific areas of the body. I know that from my own perspective, shoulder pain continues to be a problem for me. And I would like to learn something about it. How do you and your staff diagnose this problem? And even more importantly, what is the treatment for it, and how is it cured? I think I have a little injury there from
A little injury.
pulling.
So it's important to see the patient for a physical exam. You need to examine their shoulder. You need to look at their anatomy. And so what I do is I look to see whether certain movements are painful. And then we get imaging. So X-ray, MRI, these are all vital, really vital and important in diagnosing any type of pathology that's happening in the shoulder.
So do you ever have to operate on this?
Definitely. So what we always do, we always try a non-operative route first, where physical therapy, sometimes rest, sometimes medication, these are all the first steps to treating a patient. But what we often find is that there is a structural damage. And if that is, such as a rotator cuff tear, where the tendon is torn from the bone, we will then repair it. And that often requires surgery.
And the results?
Patients do really well.
Yeah.
So, we have many success stories where patients have fallen and they've damaged and torn the rotator cuff. We've done surgery, and within weeks, we're able to get them back to their level of activity.
Really? So maybe we'll talk.
Yeah, I'm always here, always happy.
Okay. Now from Dr. Gums' shoulder to tennis elbow and golfer's elbow. We hear these terms frequently used. Just what are they, and how much of a problem is it really, and what can be done about
What
it?
can be done? Now, these are very, very common problems. All right.
We have a call, excuse us. John,
Okay.
you're on the air. John, you're on the air.
Hi, I have a question in regards to what is the best over-the-counter medicine you can purchase to relieve muscle fatigue and soreness? And then on the contrary, what is the best over-the-counter supplement one can take for muscle building and muscle regeneration?
Oh, it's a difficult question. You heard it?
Yes, I
Okay.
heard the question. So, John, this is a great question. Particularly when patients come in to see us, the first thing that I like to use is anti-inflammatories. Now, I can't give you a particular name. I can give you some examples, but they all work through the same mechanism. They work to do two things: decrease pain and decrease inflammation. So we call these NSAIDs, non-steroidal anti-inflammatory drugs. And examples of these are ibuprofen, Aleve. In the office, we often use meloxicam. Toradol is actually one of the stronger ones that professional athletes will use. But really, you can buy them over the counter. Again, Advil is another example.
Right.
So these can be particularly effective if you've gone and played too hard and you have a sore joint. I would recommend using these. Now, for your second part of the question regarding muscle building, truthfully, the best thing is to do it naturally. Okay, so it's the safest and
What
best.
do you mean by naturally?
Naturally, going to the gym.
I know that, yeah.
Going to the gym, working out.
Yeah.
This is the best thing. Running, lifting weights. Now, if you want to use supplements, there's some common one, but I do recommend meeting with a nutritionist in order to do this safely.
Yeah. Why?
Well, because they have some side effects, and if you have a medical condition that predisposes you to certain reactions, for example, if you have kidney problems and you take some of these supplements, this can be quite a big problem for you.
Yeah, I think it's worthwhile sort of emphasizing because that's why I was pushing you a little bit. What's that? I can't
We have
see.
another call
Yeah, what's that? I didn't see.
from Robert. Robert is on the air. Robert, you're on the air.
Yes, thank you. I have a two-part question. My first question is, do these calcium pills, do they really help the bones, straighten the bones and stuff like that? And my second question is, if I was to have, like, let's say, an injury, am I better off having a sports medicine doctor treat me than a regular doctor?
You heard the first? You heard the question?
Yes, I had the first.
Okay, go ahead.
I heard the questions. The first one I'm going to answer is about calcium. Now, calcium is an essential ingredient for your bone health, as well as vitamin D. But just like anything, too much of a good thing could be harmful. So there are some people who are susceptible to having a calcium deficiency. And so if that's your case, then you definitely want to speak to your doctor about starting calcium supplements. Because what we found is that over the long term, your bone health, particularly as you get older, it needs these nutrients in order to stay healthy and to decrease your risk of injury and fracture. But not everyone needs this. A lot of people can get it naturally from their diet. So things like milk and yogurt, these naturally have the calcium that could be sufficient enough. So this is something that you'll need to speak to your doctor about, but it is important and actually vital for bone health that you do receive enough calcium, daily calcium.
Okay.
Now moving
There
from
was a second
moving,
part? Wasn't there?
there was
And
another
then the
part.
second question,
Okay.
Robert, do you mind repeating the second question? Is he still on the line?
It's probably gone, but there was a second.
Okay.
Okay.
But moving from moving away from Robert and following Dr. Gums' question, what is tennis elbow and golfer's
Yes,
elbow?
of
We
course.
never really got an
Of course.
explanation for that.
Well, it's the summertime now, and everyone wants to get onto the tennis court, get onto the golf course.
Right.
These are injuries around the elbow, and it's actually you can actually put out your arms and you can take a look. As you're golfing, you're holding the. You can have different grips for the club. You're hitting the ball like this, and what's happening is that your elbow is being pushed out. And so right here on the internal portion, I think we see right here, on the internal portion of your elbow,
Right.
you have tendons that attach here. Golfer's elbow is when you have the irritation along the tendons that are connecting on the inside of your elbow.
Right.
Tennis elbow, on the other hand, is for the outside of your elbow. So these are conditions that are very similar, related. They're inflammation at these points along your elbow, but they're on different parts and section of your elbow.
Now, how do you cure these, or how do you address them?
So these can often be extremely nagging, and I actually personally know. What you want to do initially is you want to shut down. So you need to give a period of rest, okay? The next thing you can do is ice. This can help with inflammation as well as the swelling.
Right.
Compression. So we have different bands and different braces that one can use to treat these. And these can be particularly helpful. And as we heard from our callers asking about anti-inflammatories, taking anti-inflammatory medication can decrease the inflammation at that side along the elbow. So these are the mainstays. You should come and see a sports medicine specialist. Oh yes, this was the other question. Was if you come and see us at sports medicine, we have other techniques that we can use. So we can do injections that provide anti-inflammatory medication directly to the site. And there's other non-surgical techniques we can use.
Right.
But if these all fail and you're still suffering and you still want to get to a high level activity, then there are some surgical techniques that we can use.
Okay, excellent.
Okay, many runners experience knee pain. What should they do initially, and when should they go and see a physician?
So if you have prolonged pain anywhere in your body, you should probably see a physician. What sports medicine, what we can do is we can, if you are not able to do the things that you would like to do, we can help assess and then identify what is the cause and treat that cause. So I think that if you have continued pain and you're not able to run, if you're not able to play the sport and it's continuous, you should come and you should see a physician.
Okay. Now, you previously mentioned the terms ACL, meniscus, rotator cuff. Can you explain to our viewers what they mean?
Oh, yeah,
You
so
hear them
much.
all the time on television shows and on sports commentary. Just what are they?
So we'll start with the shoulder, the rotator cuff. The rotator cuff is a set of muscles that are in the shoulder that help move your shoulder. They allow you to elevate your shoulder, so whenever you want to grab something from the cabinet, you're using your rotator cuff. Whenever you want to comb your hair, you're using your rotator cuff. When these are inflamed or when these are torn, it is very painful, and you don't have the strength that you typically have. So this is when we talk about rotator cuff tendinopathy or tendinitis. This is inflammation in these tendons. Or you can have a tear that could come from just time and degeneration, but this can also happen after an injury, after a fall, or even a collision during a sport, and that's a tear. So that's actually the tendon tearing away from the bone, and you're no longer able to use these muscles in order to lift your arm.
Got it.
Moving on to the knee, you have your ACL. Your ACL is a ligament in the knee that provides stability. So when you're running and pivoting, this ligament makes it so that the knee doesn't shift on itself, which can be quite disorienting and painful at the same time.
Right.
The meniscus is padding in between the knee, and it's right in between the cartilage, and this can also be torn. And when this is torn, it's particularly painful.
Okay. On that note, we'll pause for a short break, and when we return, we'll continue our discussion, as well as take calls from you, our viewers. Once again, the number to call is 718-960-7261. That's 718-960-7261. And please call us.
During this, our year of women's health, we take pride in the extraordinary success of our women's health programs. And when it comes to caring, our OBGYN team is second to none.
At Bronx Lebanon's Women's Health Center, its labor and delivery unit, and Center for Gynecological Care, services are provided in a welcoming environment.
Women in the Bronx can always depend on our OBGYN team for expert, compassionate, and highly specialized care. We deliver the best in women's health services.
Bronx Lebanon's intensive care unit is providing treatment for pregnancy and gynecological related conditions.
We work with our multidisciplinary team to stabilize our patients. Following discharge, we refer them for outpatient care at our Health and Wellness Center.
Winning the battle against breast cancer represents another crucial challenge.
At our breast cancer center, we've implemented a comprehensive approach that involves exam, imaging, and biopsy, which is clearly succeeding in the detection of early cancer.
Significant progress is also being made in the treatment of colon cancer.
Today, I will be performing an endoscopy. Our goal is to prevent cancer. By performing endoscopy and colonoscopy, we are identifying lesions which can be treated at the time of the procedure or referred for surgery.
When illness occurs, Bronx Lebanon's nurses are providing excellent and compassionate care.
We pride ourselves in understanding the physical and emotional needs of our female patients, closely monitoring their well-being and preparing them for the miracle of childbirth.
In the ER, we see some of the most dramatic examples of the Bronx Lebanon team in action.
A high percentage of the patients seen in the emergency department are women, and we are sensitive to their needs. But what is also important is that our ER is helping patients overcome all types of emergency situations.
And keeping its female and male patients moving in the right direction is Bronx Lebanon's Department of Orthopedics.
Our programs are among the best in the nation in treating bone and joint problems, including hip, knee, and shoulder replacements, as well as spine, hand, and foot surgery.
The Department of Family Medicine is another Bronx Lebanon success story.
The close relationship we have developed with women and their families has become the driving force in our efforts to provide comprehensive primary care to the community.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, ear, nose, and throat, men's health, neurology, ophthalmology, pathology, pediatrics, psychiatry, radiology, medical education, and long-term care, as well as through its Bronx Care Outpatient Network, and with the completion of its Health and Wellness Center for Ambulatory Care, Life Recovery Center for Chemical Dependency, and selection as a New York State Performing Provider System lead, Bronx Lebanon is positioned for continued success.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7261. Now, before we continue our discussion, I believe we have a return caller. Robert, you're on the air.
Yeah. My second question was in case of a situation of an injury, am I better off of seeing a sports medicine doctor over a regular doctor?
So, Robert, we can help. If you come to sports medicine, we will help get you to the right place. So it's a little bit difficult without knowing what your injury is. But if it's a musculoskeletal issue, we are specialists for this. And so I often see patients who have some type of injury, and we get them to the right patient, to the right doctor. Yeah. So, but I can tell you that if it is a shoulder, any type of your body, knee, elbow, hip, ankle, sports medicine place is a good place to start.
Okay. Dr. Gums, you have a question.
Thank you very much, Robert. Let's move to the subject of arthritis. How do you know a patient has arthritis, and what do you do about it?
So I think we should first start with what exactly is arthritis.
Yes. Yeah.
So on your bones, at the joints, you have cartilage that covers it. And this allows the bones to move smoothly. They're smoother than ice on ice.
Okay.
And when there's cartilage breakdown, this is arthritis. And what ends up happening is that the cartilage isn't there and the bones rub together.
Yeah.
That's why sometimes you hear sound in arthritis, and that's why it's particularly painful. And this is arthritis. And you have various grades of arthritis. So there's some people who have just a little bit of wear of their cartilage, and then you have some people who have complete cartilage loss.
Yeah.
And this is called end-stage arthritis.
Okay, so give me a little range of treatment.
So,
Not
you know,
too long,
the first thing with arthritis, particularly if it's in the knees, is living a healthy lifestyle. So strengthening the muscles around your joints. Weight loss is also a top thing. When you think about it, it's the force that you're putting on between the bones that is causing a lot of the wear. And so if you can lose weight, if you are overweight, this can be quite a effective treatment for arthritis.
But is it enough?
Well, it depends on what stage.
Yeah.
Sometimes we can give injections.
Yeah.
However, for arthritis, this can be a temporary. We don't have the technology yet to give back cartilage.
Yeah.
So the next step is to do a joint replacement.
Yeah.
And we do joint replacements all over the body, wherever there's a joint.
Yeah.
So both in the knee, the shoulder, the ankle, the elbow, the wrist.
Yeah.
They're even now doing finger joint replacements.
Yeah.
Right. And moving to another question very quick. What about the over-the-counter remedies, the creams that are out there,
The
that
creams.
arthritis relief?
Relief. So a lot
Are
of
they
these,
effective?
A lot of these creams are anti-inflammatories. And so we know that taking some anti-inflammatories over a tablet form is quite effective. The same thing with the cream. So there are many patients who do get relief with the cream. However, they don't get to the core of the problem often, which is when you have arthritis, you're missing cartilage, and that is painful.
I think you usually end up with surgery after a while. Right?
Very many times you end up with surgery, but it really depends on how bad the arthritis is.
Yeah.
Okay, now, what types of surgery do you perform when you do perform surgery? I know Dr. Gums is interested in that.
So, you know, it depends on the diagnosis, but around the shoulder, I do a lot of rotator cuff repairs. Sometimes it's just inflammation, so we need to just clean out the shoulder.
How long that operation takes?
It depends on how big the tear is. Sometimes the tear is extremely large, so you need to do more work. And sometimes the tear is, so typically the surgery is about an hour. And the nice thing about it is it's outpatient. So we can do it, we use the newest techniques here at Bronx, Lebanon. We do a small incisions. So oftentimes there's 3 small incisions around the shoulder. You go home the same day. You are immobilized in a sling for a few weeks. But people do extremely, extremely well.
Okay, now just one other thing that you could perhaps share with our viewers before we close this evening. What is this Game Day, Same Day program?
Game Day, Same Day is our offering to the community in order to provide availability for athletes or anyone who gets injury to come and see us right away. So if you're particularly concerned, you're on the field, you're running in the park, and you need, sometimes it's difficult to reach a physician. You can come in and see us, and we're happy to treat athletes and people who have a desire to want to get back and stay active. So this is Game Day, Same Day.
Okay. On that note, let me thank you, Dr. Babatunde, for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
If you, our viewers, have any questions or need assistance, I encourage you to call us at our Physician Referral Center. That is 718-99 That is 718-99
Bronx, or 992-7669.
Right. Or you can refer to our website at bronxcare.org. Good night.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Today, 1 out of every 4 American kids is Hispanic. That means many of the future doctors who will care for us, the engineers who will build our cities, the scientists and entrepreneurs of our country can be your kids. We all know how hard it is for you to send them to college. This is why we want you to know you are not alone. And every day, more people support you to make it happen. Many support you. And the Hispanic Scholarship Fund helps you prepare, plan, and pay for your kids' college education. Learn more at hsf.net.